So, in our body, we have nerves that connect our brains to our organs. All peripheral nerves send sensory information from the body to the brain and motor information from the brain to the body. The research that we do at the Bionics Institute looks at using the nerves in our body for the treatment of disease. Today, I will talk to you about an example of this research, which utilizes an incredible nerve known as the vagus nerve. The word vagus comes from the Latin to wander, and it does just that throughout the body. It starts in the back of the neck and contacts most of the major organs, including the heart and lungs, as well as the liver, stomach, and intestines. Well, what does this superhighway nerve actually do? Most of the vagus nerve consists of what we call sensory fibers that send information from the organs, such as the heart, lungs, and the gut, to the brain. For example, the vagus nerve also tells you how hungry or full you are. About 20% of the motor axons in the vagus nerve send signals from the brain to the organs it contacts. And one of the major roles it has is in controlling digestion. More recently, and Evanj mentioned this briefly, scientists have discovered that the vagus nerve reports to your body on whether or not the body is experiencing inflammation. The vagus nerve is then able to control the body's response to inflammation, effectively acting like a natural, indwelling anti-inflammatory reflex. So just a little bit more information on that. So the body can experience lots of damaging inflammation when it becomes infected from a cut or wound or from an autoimmune disease such as rheumatoid arthritis. When the body detects the presence of inflammation, it snaps into action by releasing immune cells that are made in the spleen. These immune cells then release inflammatory cytokines, which Evanj went into detail about. These unfortunately cause the stimulation of even more inflammation. Even though it's really important for the body to have this defense against inflammation, this reaction can easily get out of hand and do more damage than good. But not to worry, your bodies really have thought of everything. So recently, scientists from New York have discovered a natural break in the body. So after the vagus nerve detects inflammation, it sends signals to the spleen to reduce this production in immune cells and to reduce the release of inflammatory chemicals. In diseases such as rheumatoid arthritis, something goes wrong with the immune system. However, activating this natural anti-inflammatory reflex can potentially help reboot the system. Electricity is everywhere in nature. The concept that electricity can be harnessed to treat disease is an ancient idea. Ancient Greeks used electric arrays, a type of fish, to treat gout and even numb the pain of childbirth. Can't quite get my head around that. Our own nervous system also uses a form of electricity to send signals around the body and to transmit information. In more modern times at the Bionics Institute, we are using devices to deliver electricity to reboot the body's anti-inflammatory reflex, specifically for the treatment of rheumatoid arthritis. In our modern world, we have found other ways to use electricity as a therapy that does not require the use of electric fish. I'm sure you'll all be very relieved to hear that. The activity of nerves can be altered by surgically implanting a device into the body and wrapping it around the vagus nerve at the level of the neck, so what we call the cervical vagus nerve. This electrode here is made out of platinum and is held in place using medical grade silicon, which is really compatible with the body. The array is connected via a cable to a stimulator that sits here in the chest under the skin, that generates the electricity that's required to increase the natural activity of the vagus nerve. This device is actually manufactured by a company called LivaNova and is used all the way around the world. So using this device, this commercially available device, a recent clinical trial has looked at the effect of vagus nerve stimulation in rheumatoid arthritis patients. So these patients that were involved in the clinical trial were effectively drug resistant. and they had not responded to the usual therapies available to them. However, after just 2 minutes of stimulation a day over a 3-month period, half of these drug-resistant patients had improved symptoms, that being they had a lot less pain, they were able to move their joints a lot more easily, and their circulating inflammatory chemicals in the blood were reduced. This is an absolutely fantastic result, but there's a drawback. Although it is promising, there is a major drawback to stimulating the vagus nerve in the neck level. As you can see, the vagus nerve also connects to many other organs, such as the lungs, the voice box, and even the heart at this level, as well as, of course, the spleen, which is what we want it to connect to. So when the cervical vagus nerve is stimulated, unfortunately, patients experience what we call off-target effects or side effects to the stimulation. And these include coughing, hoarseness of the voice, numbness, and most alarmingly, slowing of the heart. Not only are these symptoms unpleasant, but it could also limit how long and how much therapy is delivered. So now I'm going to describe our new exciting technology and what are we doing differently? Well, the first change is that we are using a different location in the body. Essentially, we are targeting the abdominal vagus nerve, which is in the abdomen and resides below the branches to the heart and the voice box. So when we stimulate this part of the nerve, we avoid stimulating the heart and the lungs and the voice box. So patients will no longer be experiencing coughing or slowness of the heart, which are experienced when you target the neck. We've also completely redesigned the array, as you can see here. You can see that we have more electrodes, which means we are not only able to stimulate the vagus nerve, but also record from it as well. Why does that matter? Well, this means that we can 100% confirm that patients are getting their electrical therapy. And believe it or not, most devices don't have this feature. In fact, the only way you can tell if the device is working is if patients are experiencing side effects. So hopefully this solution is much more safe for the patients. So what will this technology look like in our patients? We do believe that our therapy is most appropriate for drug-resistant patients with arthritis, at least for now. The device will be implanted into the body, shown here, and this is an example of what it'll look like, using keyhole surgery, which will take about 60 to 90 minutes. The stimulator will be placed under the skin at the hip level, just below the belt line. All patients recover from surgery, and eventually the device will be switched on and set at a certain level by a clinician and forgotten about. The device will deliver the electrical therapy in the background without the patient noticing. Patients will, of course, still keep in close contact with their clinician, and if required, the dose of therapy adjusted using a computer. This concept of being able to set and forget about your medication is a huge benefit of this kind of bionic therapy. Imagine knowing that your body's natural anti-inflammatory reflex is being stimulated automatically for you. You don't have to remember to take anything or to press the remote, and even the batteries are going to be replaced every 10 years or so. So all you have to do is set, forget, and your bodies will do the rest for you. This project is a new one at the Bionics Institute, and despite a world pandemic and me disappearing off to have my first baby, it has been fast-tracked into where it is now in just under a year. And that is all down to the amazing team that I work with at the Bionics Institute. Our next steps are to start the ball rolling for a clinical trial. We are fortunate that our device has already been approved for a clinical trial to treat another disease, that being Crohn's disease. So we really do hope to see the start of a clinical trial, hopefully in a few years' time. Thank you.